If you got this question on your next generation of Nclex, would you be able to piece it all together? Let's see. We got an 18-year-old female with right lower abdominal pain, which is a huge clue, by the way, some nausea, vomiting, and that pain is increasing. And I'll be honest with you, anytime I see in an Nclex question that the pain is increasing, it is a massive flag for your girl. We know something is going down. And we don't want to just overlook these vital signs. So we see an elevated blood pressure, a little bit of an elevated heart rate, normal respiratory rate, almost a low grade temp, and then a 99% on room air. So these are, they're okay. And so our actual question, based on the information we just saw, is what diagnosis would the registered nurse be most worried about based on those presenting signs and symptoms? And so we have appendicitis, bowel obstruction, cholecystitis, and diverticulitis. Most of you are probably going to get this from the big clue of that right lower abdominal pain, because what organ exists in the right lower abdomen? The appendix, absolutely. But how could we rule out these other answers? And so let's walk through each of these piece by piece. There was one giant clue with the bowel obstruction that ruled it out in the clinical scenario, and that's the fact that they were having regular bowel movements. If their bowel movements had completely stopped, maybe a bowel obstruction. Cholecystitis, that is inflammation or infection of the gallbladder, and that is in your right upper quadrant. And so we tend to see like pain that radiates to the shoulder and different types of signs and symptoms. And then last up here is diverticulitis that we tend to see in that left lower quadrant. And so honestly, I think this question is a super great example of you can get all this information and you might get flustered and overwhelmed and anxious. But just like we talk about in our Nclex crash course, if you have that core foundational knowledge, which was here, a lot of anatomy knowledge, you can absolutely get yourself to the right answer. So when you're on that next generation of Nclex, don't freak out when you see all the charts and the vital signs and everything else, all the orders. Just go back to your core knowledge base and you're going to get this question right every time. This one is definitely appendicitis.